Good evening, Reddy ma'am.
Good evening.
Everyone, good evening.
Arya. Arya.
Hello, sir.
Good evening, sir.
Arya. Hello.
Arya ഇപ്പൊ സ്റ്റാർട്ട് ചെയ്യും രാജ്.
Yeah.
Hello. A very good evening to one and all. Can you all hear me? Am I audible?
Audible.
Thank you, sir. It gives me immense pleasure to welcome you all to the grand inauguration of the 4th Rapid Review session jointly organized by Association of Stomatologists and Maxillofacial Imagologists of Kerala and Department of Oral Medicine and Radiology, Assisia Dental College. An academic initiative that has steadily grown in strength and impact over these years. This year, we are proud to have 21 eminent ASMIC members as resource persons, each bringing sincerity, enthusiasm, and dedication to student learning. The program features 21 academic sessions with enthusiastic participations from undergraduate students across Kerala.
Hello. Hello. കട്ടായതാണോ ആര്യ? Shall we continue?
അല്ല സിസ്റ്റം ഡിസ്കണക്ട് ആയിട്ട് അപ്പൊ കണ്ടിപ്പോ വരാൻ 2 മിനിറ്റ്സ് വരും.
Good evening, Dr. Raj.
Good evening, sir.
Connection issues on something is there problem?
Area logout.
Okay.
Very sorry, sir. My system got disconnected.
Oh, it's okay. It's
Yeah,
okay.
welcome back.
I have a power
I
issue
wanted
at
to
my
know whether
end.
it
Very
was
sorry
my-
for the interruption.
Okay, right. Thank you.
With the unwavering support of our faculty and the keen involvement of our students, the Rapid Review continues to play a pivotal role in strengthening an understanding of the OMR specialty, enabling our undergraduates to face their examinations with confidence and clarity. Once again, a warm welcome to one and all. Let's proceed with the program. Now, I have the honor of inviting Dr. Raj A.C., Professor and Head of the Department, Mahi Dental College, and the esteemed President of our ASME, the very soul of the association, whose vision and dedication continue to guide its journey to graciously deliver the welcome address and to set the tone of this academic gathering. Welcome, sir.
Thank you, Dr. Arya. Good evening, all. This is a program by ASMIC and Assisia Dental College, and this is the 4th consecutive year we are conducting this unique program, the program benefiting the UG students who is appearing for the university examination. This program, in effect, beneficial for 3 universities: Kerala University of Health Sciences, Amrita University, as well as Pondicherry Central University. So it is a combination of 3 university preparations, and in the entire oral medicine and radiology in a nutshell, and this is for the preparation basis for the UG students. As well, this also makes a preparatory for faculty development program, in the sense our teachers training program, you can say, many are imbibed from the expertise presentation of our presenters, that is all over Kerala. With this few notes, I would like to welcome our chief guest of today, Dr. Anil, Controller of Controller of Kuhas University. Welcome, sir, for this function.
Thank you. Thank you.
I also welcome our dear Reti Madam, Principal of Azizia Institute of Dental Sciences, who is always there for us to support for most of the programs. Welcome, ma'am, for this program.
Thank you, sir.
I also welcome Beena Madam, our immediate past president, Anita Madam, and eminent personalities present here, and Dr. Arya, who is convening this session, and Dr. Sabil. I welcome all our ASMIC members and also the resource persons. We have a huge program for next 2-3 weeks, and many resource persons are here. And today's resource persons, Dr. Tim Peter and Dr. Miriam. And moreover, I have to welcome all our students who is actively engaged and enrolled their names for this exam preparatory program. Welcoming one and all. Thank you.
Thank you, Raj sir, for that warm welcome. Now I invite Dr. Reti R, Azizia College of Dental Science Principal, to graciously deliver the presidential address and enlighten this August gathering with her valuable insights.
Thank you, Arya. Good evening, respected Controller of Examination, Dr. Anil Kumar, ASMIC office bearers, and dear students. This is the fourth consecutive rapid review for the undergraduates. And I understand that it is actually having a comprehensive coverage. Not only it has been said about how to take up the theory exam, also there is a session which is preparing the students how to face your practical examination. And I feel mostly the rapid revisions encompasses all the aspects of the topics which has been already taught to you. And this sessions, I understand there are 21 eminent speakers who will be giving you everything in a capsule form to understand how to write your exam. See, you will understand your subject, but it's very important because our university exam is in a descriptive examination pattern, descriptive pattern. So it is very important, like the students have to, what are the points they have to write in the particular, how to attempt that particular question. It's very, very important. Because always we have seen that they learn so many things, but they don't know how to specifically answer to the particular question. So I understand that by conducting such sessions, the students will always benefit a lot having a quick revision, especially when the exam is close approaching. See, I think in most of the institution, I think this month there will be the model examination. And in the April month, the students will be taking up the university examination. I actually congratulate our HOD, OMR, Dr. Deepa and her team in association with ASMIC who have come forward to consistently conduct this rapid revision for the undergraduates. I also thank our controller of examination who, in spite of a busy schedule, has consented to inaugurate the sessions. Let all students have a very good learning from the eminent resource persons, and I wish all of them a happy learning. Thank you.
Thank you, Reti ma'am, for those thoughtful words and for being a constant support to ASMIC. Thank you, ma'am. We are indeed honored to have Dr. Anil Kumar S., Controller of Examinations, Kerala University of Health Sciences, who graces this occasion as our chief guest. Dr. Anil Kumar is an experienced academic administrator currently serving as the controller of examination at Cohas. A proud prosthodontist and the alumnus of our great government dental and professional integrity to examination management, academic administration, and regulatory processes in dental health education. He has been instrumental in ensuring transparent, efficient, and standardized examination systems across affiliated institutions. We are proud to recall that Sir has inaugurated the very first rapid review session 4 years ago, planting the seeds of an initiative that has since grown in purpose and reach. His continued association with his program lends a sense of continuity, inspiration, and a special significance to today's gathering. May I now respectfully invite Dr. Anil Kumar sir to inaugurate the 4th rapid review session and once again set this academic journey in motion. Welcome, sir.
Thank you, Dr. Arya, for that kind introduction. Dr. Raj, President of ASMIC, Dr. Deepa, Dr. Sila, Dr. Beena, Dr. Reti, Dr. Anita Balan Madam, who is my own teacher as well, and my dear students and other office bearers of ASMIC. It's indeed a pleasure to be a part of this program, especially because this program deals with undergraduate students. In fact, in the welcome address, Dr. Raj was saying that this is a unique program. Definitely, this is a unique program in the sense that very few specialty associations actually deal with undergraduate students. In fact, we have got different specialty associations, even prosthodontics, we have got Indian Prosthodontic Society and Kerala State branch is there. But normally, all these specialty associations conduct programs only for postgraduate students. So definitely, this is a unique program, and I would like to congratulate all the members of the ASMIC community for taking this initiative. In fact, it has been 4 years since this has been started, and it is continuing. Definitely, that shows the interest of the students and how these programs are benefiting them. That's the reason why we are able to continue with this program. And while going through the eminent faculties and the topics, there's a wide variety, and almost entire oral medicine in a nutshell is being covered. And that is going to help the students with the exam preparation. Naturally, we all know that the teaching in our classrooms might not just help the students to appear for the examination. They definitely need furthermore how to get prepared for the examination, how to actually face the examination. That is one of the most important aspects I think we should be contributing to the students. Quite often we have seen that even brilliant students, when they are faced with an examination, are not able to put through their full might into the examinations, or they are not able to fare well in the examinations just because it was not just because they didn't have any knowledge on the subject, but the way in which they were not rightly how to present the matter in the theory examinations was not given or taught in the colleges. So I think that can be cleared primarily through these programs. And moreover, it is also seen that few programs are being, few topics are being covered for practical examination as well. That is also a wonderful matter. And I was also asked to brief on some aspects of the theory examinations when the students are going to attend. As a controller of examinations, I have seen that some of the students definitely tend to so it happens to create problems during the examinations, or they are just not able to get through the examinations. So due to certain what I would like to say, due to certain lack in their preparedness for the examination. I would definitely say that when you are writing the theory examinations, one of the most important things that we find the evaluators, what they tell the students is that please write legibly. I have seen several of the answer books by our students as a controller itself, because at the time of the examination, especially when the answer books are scanned, the poor handwriting actually leads to very difficulty in evaluating the answer books, and sometimes the evaluators get fed up with these evaluations as well. That is one important aspect that I would like to convey to the students. Try to write answers in not only legibly, sufficiently large, because when we are scanning, most often the handwritings might get a bit faded, and the teachers might not be able to clearly read through what you have written. Another thing that I would like to suggest is that if you are able to use black pens while scanning, the contrast will help the evaluators to read whatever is written by you. And there are, of course, other rules and regulations that you need to know about the theory part. Most often, some of the students' results are get withheld just because they haven't followed the regulations of the university. I would request at this point to each student to go through the rules and regulations of the theory as well as practical examinations of the university before starting with your examinations. Anyway, these are some of the few things that I would like to point out to the students. And as I've already told, this initiative is going to benefit all of you. I take pride in inaugurating this program. I hope that all the students will benefit from this. Thank you. Thank you very much.
Thank you, sir, for those wonderful words. Thank you so much for guiding our students with tips and tricks to face the examination with confidence. I am sure our students who have heard you will surely utilize all these points while writing the exam. Thank you so much, sir, for being here despite your busy schedule. Thank you so much, sir. Now, adding grace and distinction to this scholarly occasion, we have with us Dr. Anita Balan, ma'am, former JDME. Now I respectfully invite Anita, ma'am, to felicitate the August gathering.
The Controller of Examination of Kerala University of Health Sciences, Dr. Anil, the Principal of Assisia Dental College, Dr. Reddy, the President of ASMIC, Dr. Raj, and the Secretary, Dr. Deepa, my colleagues and all the members of ASMIC, and my dear students who have joined for this program. At the onset, let me express my appreciation to the organizers of this rapid review, Assisia Dental College and ASMIC. They're doing a great job. The last 3 years, they had the same program, and I think the students have benefited a lot from this. Actually, it is not only to write the exam. You should know how to apply the knowledge you're gaining. You've joined a professional college, and being a professional, it is the depth of knowledge that is going to help you in your future success. I hope this rapid review will be of benefit to you. You have more than 21 resource persons who are highly trained and experienced.
Hello.
ഞാൻ കട്ടായി തോന്നുന്നു.
Hello.
ഹലോ,
ഇപ്പൊ കേക്കാവോ എന്നെ?
കേൾക്കാം കേൾക്കാം.
Okay. Thank you, Anita ma'am, for joining us and for being the wings behind the wings of ASMIC. Now, we are privileged with the presence of Dr. Beena Verma, Professor Emeritus, Amrita School of Dentistry, whose academic contributions continue to inspire generation. May I now respectfully invite Dr. Beena Verma ma'am to felicitate this August gathering.
Should I switch on the camera or just unmute only?
You can switch on the camera, ma'am, no problem.
No, not that connectivity, no problem. If it is there, I will not switch on the camera. I'll unmute it. Okay. Respected controller of examination, Dr. Anil, Dr. Rati, Principal, Assisia Dental College, fellow ASMICians, I can call them like that, I hope. So, and the students. This is a proud moment for all of us because this is the 4th consecutive year we are conducting this unique program. As everybody told, the unique program. Why it is unique? Because only in oral medicine we have this program for the undergraduates. Everybody concentrates on the postgraduates. But if you ask me, it is the undergraduates who need more guidance. Postgraduates are, it's not pedagogy, it is andragogy, so self-learning. So who really needs guidance is the undergraduates. So it is the brainchild of our own secretary, our Deepa madam, which initiated this, but the perseverance and persistence of her efforts, it has been fruitful. So the number of participants, looking at that, I feel it's really successful. So I congratulate everybody for participating and continually taking it forward. Thank you. I will also be a part of the, I don't know how far I can contribute, but still I'm happy to be a contributor also. Thank you.
Thank you,
Wish
Beena
you
ma'am.
all the best.
Thank you so much, ma'am. As we gently draw this inaugural session to a close, may I now have the honor of inviting our vibrant Secretary of ASMIC, Dr. Deepa MS, Professor and Head of the Department, Oral Medicine and Radiology, Assisia Dental College, the heartfelt force and a quiet architect behind this program, whose vision, perseverance, and tireless dedication have breathed life into every detail of this program. I gracefully invite you to deliver the vote of thanks, ma'am.
Good evening, all. Respected Dr. Anil Kumar S., Controller, Kerala University of Health Sciences, Dr. R. Reddy, Principal, Assisia College of Dental Sciences and Research, Dr. Anita Balan, Dr. Anita Balan, Madam, immediate past President of ASMIC, Dr. Beena Verma, Ma'am, again immediate past President of ASMIC, Dr. Raj AC, President ASMIC, Dr. Srila, President-elect ASMIC, and all my dear EC members and my dear students. I am truly honored to deliver the vote of thanks for today's inaugural session. First and foremost, I extend my heartfelt gratitude to Dr. Anil Kumar S., Controller KUHS, for readily accepting our invitation and briefing the tips and tricks of exam writing, and also for graciously inaugurating the Rapid Review 2026. Thank you, sir, for your support, encouragement, and motivation. A very big thank you to Dr. R. Reddy, Principal, Assisia College of Dental Sciences and Research, for the presidential address, and also for all the support extended to us for all our activities. Thank you, ma'am. Sincere appreciation and gratitude to Anida ma'am, Beena ma'am, Dr. Rajesi, Srila ma'am, and all our esteemed EC members of ASMIC for your invaluable contributions in making this program a success. I also wish to place on record a huge thanks to the resource persons, the most eminent OMR faculties of Kerala, for sharing their expertise and guiding us with such dedication. Thank you all. Heartfelt appreciation goes to the undergraduate students across Kerala. We have more than 150 registrations, for the keen interest in enhancing knowledge and for the sincere efforts you are putting in to improve your performance in the upcoming exams. On behalf of the organizing team, I wish you all 10 days of joyful and enriching learning experience. Thank you all once again for being part of this memorable occasion. Thank you.
Thank you, Deepa ma'am. With those heartfelt words of gratitude, we formally conclude the inaugural session of the 4th Rapid Review sessions. May the academic exchanges that follow be enriching, inspiring, and enduring. I thank you all for your gracious presence and wish every participant a meaningful and rewarding learning experience. I now have the pleasure of passing the baton to Dr. Shabil, Professor and Head of the Department of Oral Medicine and Radiology, who will take over as the moderator of the upcoming session. Welcome, Shabil.
Good evening, everyone. It's my privilege to introduce today's speaker, Dr. Tim Peter. Dr. Tim Peter is an oral physician and maxillofacial radiology specialist who is currently serving as an associate professor at KMCT Dental College. He has over 15 years of academic and clinical expertise, including the roles as assistant professor, lecturer, and director and chief dental surgeon of Emerald Dental Clinic. His core expertise includes CBCT, CT, MRI, ultrasound imaging, digital radiology, and laser dentistry. He has published 28 indexed international articles and holds 1 patent. Dr. Tim is a recognized PhD and postgraduate grade under COHAS and serves as a university examiner for multiple Indian universities. He is an active reviewer for reputed dental journals and is a life member of leading professional dental bodies. His career reflects a strong balance of academics, advanced imaging, research leadership, and clinical excellence. Welcome, Dr. Tim. Over to you.
Thank you, Dr. Shabil, for the introduction. Hello. Can you see the, is the screen visible?
See, but it is blank. You can share the entire screen.
Can you? Is it visible now?
Yes, it is visible. Visible.
Yes. Hello.
Yeah, it is visible. It is visible.
Okay. Okay. Fine. So at the outset, I would like to thank Assisia Dental College and ASMIC for this opportunity, for providing a session, for giving a session on this rapid review of oral medicine and radiology. So without much delay, let me get on to the topic which is bestowed upon me. So I'll be discussing on these two topics today, with purely from an exam point of view, that is radiation physics and intraoral radiographic techniques. So in a 45 minutes to 1 hour session, it is as everybody knows, it is not possible to go into the details of these topics. So what I have planned is, I will brief through the important points in these two sections, radiation physics and indoor radiographic techniques. And towards the end of the session, we will go into the different types of questions which is asked from these sections. That is, of course, which are the long essays, which are the short essays, and which are the short notes which is coming from these sections. So that will be the format of the today's 1 hour session. So let's get on to the topic. So first of all, let us revise what all we should what all should come to our mind when we start studying, or when we start revising about radiation physics. So first of all, of course, electromagnetic spectrum. That is, as you all might be knowing, or rather, as you all had already studied, it is the broad spectrum. It is the we all deal with the X-rays, which comes under the electromagnetic spectrum, wherein the different types of radiations. That is, what is electromagnetic spectrum? That is the radiations which is having an electric field and the magnetic field, and it is propagated perpendicular to each, as well as to the direction of the beam in which the beam is transversing. So that's the properties of electromagnetic radiations. And visible light, ultraviolet rays, X-rays, gamma rays, infrared rays are the different types of radiations which is coming under the electromagnetic spectrum, which is arranged in an order of increasing wavelength and in an order of decreasing frequencies. We'll be getting into the bit more details regarding the electromagnetic spectrum. Then another important section in radiation physics is regarding the X-ray machine and its parts. That is, it is often asked as a long essay question in KUHS. We all should be very much aware of how an X-ray machine appears. That is, regarding the working of an X-ray machine. Where is the cathode? Where is the anode? What is the production? How the X-rays are produced within the X-ray machine? So for that, a neat label diagram with the functioning is important, which again we'll be brushing through. Then another important.
Excuse me, sir.
Yes, ma'am.
Sir, the slides are not changing.
Is it okay now?
Yes.
Okay. Shall I continue?
Yes, sir. Yes, sir.
Okay. So back to the topic. So radiation physics, as we have discussed, we should be aware of what all things comes under the electromagnetic spectrum. Then regarding the X-ray machine and its parts. From an exam point of view, it is very important because in each and every question from the last 10-15 years, not even one question paper question from radiation physics was skipped. It often comes as a long essay or as a short essay. Then going on to the next section, that's the power supply. That is, you know that in our normal incoming voltage it is 230 volt, whereas in an X-ray machine for the production of X-rays, we need to step up the voltage to 60 to 80 kilovolt. That is done by the step-up transformer, which helps us to generate electrons with high potential, thereby.
Excuse me, Dr. Tim.
Yes, please.
Lot of background noise. Your voice is not audible.
One second. I hope it's okay now.
Now it is better.
Okay. Sorry for the delay. So, going on, regarding the power supply, as I had mentioned, the step-up voltage, step-up transformer helps the X-ray machine to increase the voltage to 60 to 80 kVp, with which the electrons can be made move at a faster rate, which leads to an increased efficient production of X-rays from within the X-ray machine. Then what happens or how the X-rays are produced at the anode, what are the interactions happening? Again, we'll be briefing on to that. That is two types of interaction that happens at the anode, which leads to the production of X-rays. That is the Bremsstrahlung radiation and the characteristic radiation. So these are the things which is happening within the X-ray machine, which leads to an output of the X-rays that is produced from outside, from within the X-ray machine. Then after the X-rays are produced within the X-ray machine, the X-rays are traversed out and it goes on. It hits the soft tissue of the individual, rather the patient. Then it goes on to hit the hard tissue. Then it of course goes on and hits the image receptor. So that happens here. That's the interaction with matter. What are the interactions? What are the three types of interactions that is possible for an X-ray when it interacts with the soft tissue and the hard tissue? That is three types. That's the coherent scattering, content scattering, and the photoelectric absorption. And another thing regarding the X-ray beam production is that which are the different factors that regulate the production of X-ray beam. Again, from an exam point of view, extremely important. 6 factors, 3 factors, which is KVP, MA, and exposure time, and the three property-related factors, that is the collimation, filtration, and the inverse square law, which again we will be briefing through. Then the last part of the radiation physics section is regarding the dosimetry. Short notes questions comes from the section dosimetry. So we'll just go on to the before set topics one by one, a bit more detail. So as mentioned before, electromagnetic spectrum. So from this section, the properties of X-rays, it itself comes as a short note question or a short essay question. So basically it's about the spectrum or the range of radiations which is depicted as electromagnetic radiation. As the name implies, it has both electric field, magnetic field, and both are perpendicular to each other to the direction which the radiation is passing through. And it is arranged in decreasing or increasing order of the wavelength and in the decreasing order of the frequency. Gamma rays, X-rays, ultraviolet rays, infrared, radar waves, short waves are the forms the range of different types of radiations which in the electromagnetic spectrum. Next section, as mentioned before, the parts of an X-ray tube. So the image is very clearly given in the white and fluorescent section, but from an exam point of view, when the question is asked regarding the production of X-rays, describe in detail with the diagram about the parts of an X-ray tube.
Dr. Tim,
Yes,
me.
please.
Could you make it in a presenter view?
Can you see the slide or is it stuck?
Slide is visible, but it is still in the slide view. I think you can click that button at the top bottom and
as it was getting stuck, that is the reason why I had opted out of the presenter.
Okay, fine. Please carry on.
Okay, so the image is given clearly in the white and furrow. I just want to explain it in a brief point of view. So, so this is the schematic diagram which explains how the X-rays are produced within the X-ray tube. So when we look from outside, we see a a metallic case. That's all what we see. So what's happening inside that? Or if you open the X-ray tube, what's happening? So you can see a cathode, you can see an anode, and as mentioned before, this after the step-up transformer, the high potential difference of 60 to 80 kilovolt peak is attained at the cathode, following which the tungsten element which is present at the cathode eliminates the electrons from the cathode towards the anode at a high speed, and following which this ejected electrons hit the anode tungsten target, following which the two types of interactions happens at the anode tungsten target, that is the Bremsstrahlung radiation and the characteristic radiation, following which useful X-ray beams are produced at the target anode, and following which the useful X-ray beams are coming out of the X-ray machine. So this is the simple procedure in which X-rays are produced from within the X-ray tube. So there are few important things which we have to keep in mind regarding this. We are talking about the electronic emission. So definitely other interferences, other gaseous molecules within the atmosphere should not be there. Henceforth, a vacuum is maintained, and the importance of tungsten, high melting point, rich source of electrons. The material should withstand the high temperature. That's the reason why the tungsten is used as the cathode, and it is lodged in a molybdenum cup. That is the cathode, which is negatively charged, and following the high potential difference as mentioned before, it goes and strikes the anode tungsten target. And as you can notice clearly, it is kept at an angle. That is the reason. That's why, because of the effective focal spot size, so that a maximum efficient X-ray production is made possible at the anode. So this is the in brief, in nutshell, regarding the production of X-rays. With the diagram, I think you should be able to explain it in a better way. So please make sure that you draw the diagram neatly and perfectly, which will send a good impression about you yourself in the answer paper when the evaluator analyzes this. And it is often asked as a long essay question, or at least as a short essay question, very often. So, and the next thing regarding the radiation physics, as mentioned before, it was basically regarding the power supply. So, as mentioned before, the 230 volt will not be sufficient enough to produce this magic of X-ray production. So, definitely it has to be stepped up, and this is the step-up transformer, wherein the normal incoming AC voltage or 230 voltage is stepped up to 60 to 80 kVp, which is liberated towards the input of the X-ray tube, which makes the efficient production of X-rays. So this is the step-up transformer circuit, which you should be aware of. Regarding the production of X-rays that I had mentioned before, what happens, the two types of interaction that happens at the anode, following that's the electrons comes from the cathode, strikes the anode tungsten target, two types of interaction. That's the Bremsstrahlung radiation and the characteristic radiation. These are the schematic representation of that Bremsstrahlung and characteristic radiation. So as you look at the image closely, it is very clear that what happens here. So Bremsstrahlung radiation means the incoming electron from the cathode strikes the nucleus, or it's the interaction with the nucleus. Whereas what happens in the characteristic radiation, it is the interaction with the outer orbit electrons. So it is as the incoming electron hits the nucleus, it gets deflected, and the difference in energy is released in the form of X-ray photons. So that is the Bremsstrahlung radiation, or the braking radiation. Whereas the characteristic radiation, what happens is incoming electron hits the tungsten target anode. It displaces the electron from the K orbit, or 1 orbit, and following which the electron is displaced and a vacancy is created. And you know that nucleus is positively charged, which attracts the electrons outside, So the vacancy is filled by the next orbit electron, towards which the electron is displaced, following which the energy difference is released in the form of the X-ray photons. So basically these are the two types of interactions that happens at the anode, which leads to the production of a useful X-ray beam. So please make sure that you are mentioning Bremsstrahlung and characteristic radiation neatly and clearly when you write about the production of X-rays, when it is asked as a long essay or as a short essay usually. Next, and another important thing in the radiation physics is the factors controlling X-ray beam. It is again quite self-explanatory, a relatively simpler area. Three factors. What are the factors that can affect the production of X-rays? KVP, MA, exposure time. So what is KVP? Kilovoltage peak. That is, it depends on the, to make it simple, it is the strength of an electron, or rather strength of the current. That is, the more the KVP, the more strength the generated X-ray photons will be having, and the more the milliamperage. The more the milliamperage, the more the number of X-ray photons. So the increase in KVP means the X-ray photons will be having more penetration power, whereas the increase in current means there will be the number of X-ray photons will be more. And exposure time, again directly proportional to the X-ray production. Then three other factors, three mechanical factors, that is a filtration, collimation, and the inverse square law, that is regarding the make of the X-ray machine. So what is filtration? So it's basically it has it is basically it has an internal filtration and the added filtration, and the material uses aluminum. So the main purpose of filtration is to make sure that whatever X-rays are produced is produced in an efficient manner. And next, collimation. What do you mean by collimation? It is basically the metallic barrier which aligns the X-ray beam. The X-ray beam produced must be must be directed towards the target without any unnecessary exposure to the other vital structures. So lead is the material which is used as a collimator, and different types of collimators are rectangular collimators and the spherical collimators, to make sure that the X-rays produced are aligned towards the target area in an efficient manner. Then the last factor which has a role in the X-ray production is the inverse square law. That is, the intensity of the X-rays produced is inversely proportional to the square of the distance. That is, as the distance increases, intensity is reduced to 1/4. If the distance is doubled, intensity is reduced to 1/4. Intensity is inversely proportional to the square of the distance. Yes, regarding the inverse square law. So that was regarding the factors regulating the X-ray production. Then another important thing regarding after what happens to the X-ray machine, what happens to the X-rays after its interaction with the soft tissue and the hard tissue. So basically three types again. As X-rays which is produced traverse outside, it hits the soft tissue, hard tissue, and the image receptor. So three types. So three types of interactions are possible. One is the coherent scattering. Second thing is the photoelectric absorption, and third one is the Compton scattering. So what do you mean by coherent scattering? So coherent scattering is again similar to our interaction before. That is similar to the characteristic radiation. It has that is, the incoming X-ray photons hits the soft tissue. Of course, the soft tissue is made up of an atom in the periodic table. And what happens? The outer orbit electron gets displaced. That is, the scattered X-rays are coming and hitting at the electron in an outer orbit electron, and following which the incoming photon gets scattered out, and the difference in energy or the difference in the scattering is recorded as it hits the image receptor. So that is the interaction of coherent scattering which happens with the incoming X-ray photons with the soft tissues. Then the second type of interaction that happens with the matter is the photoelectric absorption, which is similar to the uh, again the characteristic radiation, wherein the the difference between coherent scattering and photoelectric absorption is uh, in the coherent scattering, the incoming X-ray photon is just scattered out, whereas photoelectric absorption, what happens is the colliding after the collision, the electron is displaced, following which a vacancy is created. Again, following the vacancy, the electron from the outer orbit gets drawn in towards the vacancy which is created towards the nucleus, and the difference in energy again is released in the form of an altered X-ray photon which hits the image receptor. So that's a photoelectric absorption. And the third one is the Compton scattering. Compton scattering, how it is different from it is similar to coherent scattering. How it is different from coherent scattering is in the coherent scattering, it is just the momentary vibration of the outer orbit electron, and whereas in Compton scattering, it is the displacement. The outer orbit electron gets displaced, and the difference in energy is released, and the outgoing X-ray photon hits the
Okay, Tim.
ഹലോ
സാർ ഇപ്പൊ ജോയിൻ ചെയ്യും. അത് പുള്ളിയുടെ പാസ് എന്തോ അവിടെ നിന്ന് വന്നതാ.
ഓക്കെ
ഞാൻ വിളിച്ചിട്ട് please wait for few minutes. Speaker will join back very soon.
Hello.
Yes, sir. Yes, sir.
We can see you.
Yeah. Sorry for the technical glitch.
No, it's not. Please carry on.
Is the slide visible now?
No, it's not fair yet.
Is it visible now?
No, not yet. No, yeah. Yeah, now it's visible. Slides are visible. Team? Yeah, now you're seeing it.
കേട്ടിയതാ ഇന്ന്
Hello, is the screen visible now? Are we back?
Yeah, now it is visible.
Okay. I really apologize for the technical issues. It's due to some network issues. So shall we proceed, please?
Yes, please proceed. Please.
Okay. So intraoral radiographic techniques, periapical radiography, bite-wing radiography, and occlusal radiography. So periapical radiography, IOPA. What do you mean by that? Intraoral periapical radiography. So as the name implies, what is it indicated for? It is definitely to visualize the periapical region of a tooth. So what do you mean by that periapical? That word peri means surrounding. Apical means, of course, the apex of the root. So the structures which is surrounding the apex of the root is what we are supposed to focus upon. And that is exactly what is visible in the periapical radiography. So to visualize the structures in the periapical region, so there are basically two techniques, paralleling angle technique as well as a bisecting angle technique, which we will be briefing through. Then definitely the indications of periapical radiography. So indications of periapical radiography, it itself comes as a short essay in the university paper. So there is an easy way to write out the indications of periapical radiography. You can think about the different departments in your dental college. So what are the departments they are, what are the treatments they are doing, and from a radiographic point of view, we can write down the indications regarding that. So without much delay, we'll go on to the two techniques which is used in the periapical radiography. First one is a paralleling angle technique, which is a simple technique, but because of its few technical constraints, it is not that frequently used. So it's a simple technique based on the principle of parallelism, which is achieved between the long axis of the image receptor and the long axis of the tooth. As the diagram implies, it is a simple principle. The incoming X-rays is perpendicular to the long axis of the tooth as well as to the long axis of the X-ray film or the image receptor. And a simple parallelism principle is used to cast the image of the object on the image receptor. Before said, the mechanical issue is regarding the morphological anatomy of the bones. That is in the posterior maxillary region, in the mandibular region, in the tongue interferences. It might not be an easy way to achieve this parallelism, and that is the reason why this paralleling angle technique is not frequently used. It's a viva question. So from an exam point of view, it is asked often as a single question as well as a comparison between the bisecting angle technique and the paralleling angle technique. So primarily both are used to visualize the periapical region of the tooth. So the next technique, the most commonly used technique, bisecting angle technique, which you might be already aware of. So I'm just refreshing yourself. So it's basically what you can see the long axis of the tooth here. You can see the long axis of the filling here. There is an angle formed here. There is an imaginary bisector, the green line, which you can see as the bisector, which divides this angle into two equal halves. And you can see the incoming X-ray beam, which is perpendicular to this imaginary bisector. And that principle is called as the Szyszynski's rule of isometry, based on which two equal confluent triangles are generated here. That is the X-ray beam, which is perpendicular to the imaginary bisector, following which the uh, hypotenuse of this triangle is casting the object image. The same hypotenuse of the next congruent triangle is casting the image of the object. So that is the principle based on which bisecting angle technique works. So on this technique, basically there are two angulations involved. That is, one is the vertical angulation and another one is a horizontal angulation, which I hope you are aware of. I'm just refreshing yourself. So vertical angulation, say for example, maxillary anteriors you think about maxillary central incisor. You think about plus 40 degree. So what is this plus 40 degree? It is the angle made by the incoming X-rays with the occlusal plane, which is kept parallel to the floor. So definitely the patient has to be seated in such a way that the back and head is well supported, and to make sure that the occlusal plane is parallel to the floor, and that is the plus 40 degree. That's why plus 40 degree is given for the maxillary teeth for the bisecting angle technique. Whereas the mandibular teeth, the X-rays is pointing from a downward direction towards upward direction. So as it is in the third quadrant, it is creating a negative angulation. So that was regarding the bisecting angle technique and the paralleling angle technique, two techniques which is used for the periapical radiography. The second type of intraoral radiography is the biting radiography, which again, as the picture implies, it is basically to assess the the interdental region as well as the proximal surfaces of the teeth caries. The first technique, periapical radiography, was focusing on the periapical region of the tooth, whereas the biting radiography is to assess the proximal caries as well as the interdental bone loss. Questions comes as the indications and technique of biting radiography. So indications is primarily regarding the periodontal status of the teeth as well as the proximal caries of the teeth assessment. Third type of intraoral radiographic techniques is the occlusal radiography. Occlusal radiography, it can be a bit diverse. That is basically, it's about the cross-sectional occlusal radiography as well as the topographical radiography and of course a pediatric form. Cross-sectional radiography refers to an button-shaped appearance, that is something like this. Please focus on this image. The central X-ray is targeted from the tip of the nose at an angle of around 65 degree, wherein the entire occlusal surface, the entire dentition is created in a single film to assess the buccolingual expansion. So that is a cross-sectional maxillary occlusal anterior radiograph. Whereas a topographical view, that is the anterior and the posterior lateral radiograph, wherein only one side is assessed. So here, what are the basically what you have to understand is, it is basically to assess the buccolingual expansion of the lesion. Say for example, you talk about ameloblastoma, you talk about OKC to an extent, odontogenic keratosis to an extent, which causes then buccolingual expansion. So amount of buccolingual expansion cost can be assessed only with the help of occlusal radiograph or in the axial section. So that itself is the indication and the technique of the occlusal radiography. It is not usually asked as a long essay question, and it comes as a short note or as a short essay. So that was regarding the questions. That was regarding the summary of the two topics which was scheduled for today. So now we will just see the questions which was asked in the previous years in the KUHS exams. So long essays in Jan 2017, the long essay question was discuss the properties of X-rays and the production of X-rays in detail. So when such a question comes, usually it comes as a 10-mark question. So discuss the properties of X-rays. It will be usually for 5 marks, and the production of X-rays in detail. So properties of X-rays, as mentioned before, X-rays comes under the electromagnetic spectrum. So the properties of electromagnetic radiation has to be enumerated in detail. As mentioned before, electric field, magnetic field, it has a both wave nature and a particulate nature. So all the properties of X-rays has to be enumerated it down. Then the second aspect of the question is the production of X-rays in detail. The neat label diagram is a mandatory requirement for this question when it comes as a long essay. The cathode anode has to be neatly drawn, has to be labeled properly, and a neat label diagram itself conveys a very good impression about yourself to the examiner. So the examiner knows that this candidate is aware of the concepts and which will make your life much more easier. And regarding the production of X-rays in detail, please remember the basic concepts which was discussed in the session. That is the interactions which happens at the anode, the Bremsstrahlung radiation and the characteristic radiation, which acts as a backbone regarding the production of X-rays. And it has to be explained in detail. And with a note on the cathode, anode, what are the properties of tungsten, which makes it an uh, uh, first choice material in cathode and anode. Then in November 2020, occlusal radiography was asked as a long essay question. Rarely describe the technique and indication. That is, it was not asked before. Describe the technique and indications of occlusal radiography. So, technique. So basically, you'll have to give a brief introduction regarding the occlusal radiography, where it belongs to. It is a type of intraoral radiography, and which are the types of occlusal radiograph: anterior, topographical, pediatric, anterior, and the lateral. The indications, the buccolingual expansion. What are the indications? What are the technique? So it has to be it has to be explained step by step in detail. This one by one has to be explained in detail, as it had come as a long essay. Then what are the different IOPA techniques? Write in detail about principle, methodology, advantage and disadvantage of bicycling angle technique. It was asked in February 2013. I'm not sure whether I had missed. I think it was asked again also. I am not very sure. You'll have to please get back to the previous question papers once more. But anyhow, it is an important section regarding the exam is considered. Different IOPA techniques हम लोग discuss इधर periapical radiography, biting radiography. Sorry. The question was what are the different IOPA techniques. So the focus has to be based on the focus has to be on the bisecting angle technique as well as the paralleling angle technique only. Need not mention about anything about biting or the occlusal radiography. So focus on the paralleling technique, bisecting angle technique, and the bisecting angle technique has to be explained in detail. Cieslewski's role of isometry, methodology, right from the patient walking into the radiology, the seating of the patient, the principles which has to be followed while taking the radiograph, advantages and disadvantages of bicycling angle technique in detail. Please make sure that you are writing specifically to the question, because there are specific value points which is given to the evaluators to assess your answers. Another long essay from this section, it was regarding the describe the production of X-rays, describe in detail the principle and method of paralleling technique of periapical radiography. We had discussed this before, production of X-rays, paralleling angle technique of periapical radiography. Few more long essays which had come under the section, discuss the principal, advantage and limitations of various intraoral periapical radiographic techniques. So techniques means basically paralleling angle and bisecting angle technique. So please make sure that you read the question properly, whether it is intraoral radiography or whether it was intraoral periapical radiographic techniques. So when the question is regarding the techniques, you focus on the periapical radiography and the bisecting angle technique only. And another question which was asked was regarding the comparison between the bisecting angle technique and the paralleling angle technique. Okay, so going on, the few short essays which was asked from this section. Hello. Am I?
You're audible.
Yeah, thank you. So short essays, which is the questions which had come as short essays from this section. It was in July 2016 and 2022 in KUHS comparison of paralleling angle technique and bisecting angle technique, which was discussed before. So so when the question is coming as a short essay, please make sure that it is based on the points. So what are the technical difference between the bisecting angle technique and the paralleling angle technique? What are the advantages? What are the things which is difficult in the paralleling angle technique, which is easy in the bisecting angle technique? നമ്മൾ നേരത്തെ ഡിസ്കസ് ചെയ്ത കാര്യങ്ങൾ തന്നെ. Another question which is coming under this section as a short essay, properties of X-rays, നേരത്തെ ഡിസ്കസ് ചെയ്തായിരുന്നു. Electromagnetic spectrum we had discussed. Intraoral radiographic techniques, again, please make sure that you read the question properly. Answer to the question precisely. So intraoral radiographic techniques. So yes, techniques, bisecting angle technique and paralleling angle technique for the periapical radiography. So the question is the techniques. It's not the intraoral radiography. So when the question is intraoral radiography, you'll have to focus on periapical, biting, and the occlusal. When the focus is on the technique, please make sure that it's regarding the periapical radiography techniques. Factors controlling X-ray beam production. Another short essay question. 6 factors which was discussed before. KVP, MA, exposure time, filtration, collimation, and the inverse square law. 6 factors. Please make sure that you are not going to forget these 6 factors in your entire, say for example, life, because it's going to help you out once you pass out and once you start off your practice from an early medicine radiology point of view also. So it was discussed before. Another short essay question which was which had come under KU, which is on Feb 2015, was occlusal radiographic techniques and indications. Again was discussed before. So going on, few of the short notes questions which had come under these two topics, physics and intraoral radiographic techniques. Biting radiography, which had come under on May 2010, Feb 2015, May 2021. Biting radiography, നേരത്തെ പറഞ്ഞായിരുന്നു. So when the question comes as a short note, please make sure that you don't have to write more than half a page, maybe, or at the max you can write maybe 3/4 of a page. That's more than enough, and beyond that you cannot write, because if you work out the time, you get around 3 to 5 minutes maximum. 5 minutes also it's difficult. So 3-4 minutes is what you get. So you'll have to quantify your answers. So biting radiography, at times such blunt questions may also come. So when such blunt question comes, how you can address is a simple thing. You can go ahead with the indications of biting radiography, technique of biting radiography, and maybe advantages and disadvantages of biting radiography. So 4 points, you get the 5 to 8 lines, which will be sufficient enough to get the full marks, or more than 75% of marks of that question. Dosimetry, again, which are the different radiation dosage units, which are the different types of radiation exposures. That's it. This you have to enumerate, and you can just mention the different types of units. Electromagnetic spectrum, it is often confusing that when it comes as when the same question is asked as a short note, and when the same question is asked as a short essay. I understand that it is confusing, but the way out is electromagnetic spectrum when it is asked as a short note, and you get 3 to 4 minutes of time. So just mention about the different types of visible light. Remember the spectrum, visible light, X-rays, infrared rays. What are the basic properties of electromagnetic spectrum? In that is the array of radiations arranged in the form of an increasing wavelength and the order of decreasing frequency. And you can write few common properties of the electromagnetic radiations that should be fine enough to address this as a short note. Then occlusal radiography, it's funny when the same question is asked as a long essay, short essay, and as a short note. So it's challenging also. So occlusal radiography, when it comes as a short note, you are expected to write 5 to 8 lines about occlusal radiography. Types of occlusal radiography, indications of occlusal radiography, advantages and disadvantages. So please remember these key points: indications, technique, advantage and disadvantages. It will make your life much more easier when you come across with these type of confusing questions in the short notes. Bisecting angle technique, again, surprising when it is coming as a short note, but it is a fact as it had happened in July 2016 and in Jan 2019. It was asked as a short note. So when it is asked as a short note, we'll have to go for it. There is no way out. There is no options. It's all our must attempt questions. So bisecting angle technique, 5 to 8 lines about bisecting angle technique. Simple things, indications. Bisecting angle technique. Okay. So we'll have to focus on the main thing. What is that? Szymanski's rule of isometry. So that's the basic principle by which bisecting angle technique acts. And what are the advantages? So technique advantages should be fine enough. And of course, you can start off with it is the most commonly used technique used in periapical radiography. The introduction is important. Bremsstrahlung radiation നമ്മൾ നേരത്തെ ഡിസ്കസ് ചെയ്തായിരുന്നു. The types of interaction of which is happening at the anode which leads to the X-ray production. So focus on Bremsstrahlung radiation only. Just the interaction with the nucleus. If you remember, incoming electrons comes from the cathode, strikes the anode target. The interaction happens with the nucleus, and which is explained in the form of Bremsstrahlung radiation. The electronic interactions is explained in characteristic radiations. So short notes, you don't have to go for format. Another thing which I had forgotten to tell was, when the question is asked regarding the long essay and the short essay, please make sure that you give an index. You give a format, you give the side headings, which are the things which are going to explain in that section. So towards the last part, short notes, few more short notes, which was asked in the university exams, July 2018 collimation. നേരത്തെ ഡിസ്കസ് ചെയ്തായിരുന്നു. So it's basically whenever you hear the word collimation, the concepts which should come to your mind is regarding the alignment. The X-rays are produced. X-rays has to be aligned in such a way that there is no unwanted exposure. Rectangular collimation, spherical collimators, and how this is achieved with the help of lead to make sure that the X-rays produced are aligned towards the target areas. Types of interaction of X-rays with matter, July 2018 KUHS. We have discussed coherent scattering, Compton scattering, and the photoelectric absorption. So I'm not repeating that as in a short note. So you are expected to write again 5 to 8 lines. Just in brief, what is coherent, what is photoelectric, and what was Compton. Indications of Whiting radiograph, Jan 2017. We have discussed proximal caries, interdental alveolar bone assessment, paralleling angle technique, challenging when it comes as a short note question, simple way out technique, indications, advantages. Of course, you have to start with it is a type of periapical radiographic technique. So that's it. With that, I would like to conclude my session today. I would like to have a discussion if any of you have anything to say, discuss regarding these two sections. Once again, I would like to apologize for the technical issues which had happened during the session. So if there is anything from your side, I will be more than happy to discuss it out.
Dear participants, the session is open for questions. You can unmute and ask your doubts.
Okay, if there are no more no discussions, I would like to wish you all the best for the upcoming exams. I would like to give some take-home advices. Please make sure that you read the question properly. Please make sure that you give a format, you give an index to the long essays and the short essays before you start writing. Short notes, please make sure that you are within the stipulated time and in the prescribed frame. So that's all from my side. I thank you all for your patient listening, and once again I apologize for the technical glitches that had happened during the presentation. All the best. Thank you.
So you can stop sharing, Dr. Tim. As a token of appreciation, kindly accept the certificate.
Thank you. Thank you for that.
Have you stopped sharing the screen?
Yeah, I have stopped sharing the screen. Dr. Shabil, if
Is it visible now?
yeah,
Okay.
thank you. If there are no more queries, shall we wind up?
Yeah. There is no more for you can wind up. Sarah? That's sir?
Thank you, Dr. Tim.
Yes.
Thank you, ma'am.
Thank you, dear participants, and thank you, Dr. Tim.
Thank you, sir.
Yeah, we will wind up. One more thing. Hello.
Yes, sir.
About tomorrow's topics, can we just have an announcement?
Tomorrow's topic, first session by Dr. Vani, and that's on recent advances in maxillofacial imaging, CT and CBCT. And the second session is by Dr. Himajon, and the topic is orofacial pain, TMJ, and TMJ disorders. So
Yeah,
it
both
will
are very
be very
important.
easy for you if you prepare and come, isn't it? So
Correct.
it's possible, just study and come so that it will be easy for you to follow also. Thank you all. Thank you for the patient listening, and apologize for the technical glitches. Thank you all. Good night.
Good night.
Thank you, ma'am.